Hey ladies. Okay, so, oh Lord, what is going on with this camera? The camera is just not cooperating today, like for real. Okay, so that's, I guess that's better. I'm hoping I'm not crooked. Okay, so anyway, basically I've come to respond to a message and a couple of comments. And it's so ironic that I guess it's kind of ironic how this came up, because something in me was like, just tell her about it, just maybe it'll work, you know. So anyway, basically 76mrsmartin had reached out to me. Well, basically she had made a video rather, and she's kind of like at her wit's ends because all of her tests have just came back inconclusive. So basically she has, I believe, 2 eggs left. That's not 2 eggs, but 2 embryos left in case she want to do a frozen embryo transfer. And basically her and her husband just did some more testing with his I think it was like a semen analysis or some kind of something to test to see what was going on with his little men, make sure that they weren't the reason of the eggs or the embryos not implanting. Now when you made this other video, 76mrsmartin, when you made this other video, and it was basically like, you know, if you have any advice, you know, let me know, whatever. I was like, well, maybe I should tell her. I didn't know if everybody did it or if it's few people that did the mini HCG injection, because I know when I took it, I looked online and I didn't see hardly anybody taking it. And so I had to question my doctor too, like, okay, well, why am I taking this? Because not a lot of people, you know, are taking it. So anyways, is this TV too loud? Let me turn it down a little bit, hold on. Okay, I got my little old school playing. Okay, so anyway, I went and dug up all my papers, like all my, not all of them, but the ones that kind of dealt with this subject. And okay, so basically everybody is pretty much familiar with the trigger shot itself. Everybody know what it does, everybody know what it's for. It's the last shot that you take basically before you go and do your transfer within, is it 24 to 48 hours, somewhere up in there, if I'm remembering correctly. But basically, I thought, I was like, I talked with my doctor and I said, well, if I'm taking the HCG after my transfer, I said, isn't that supposed to make me like ovulate or something, or make, you know, like, you know, or start the ovulating process? I said, why am I, you know, taking it during, you know, after my transfer? And basically what I understand, from what I understand, is the HCG given at different points of your cycle, or of your what word I want to use, your procedure, or, you know, of what you're going through, it works different ways. And after the nurse told me that, I actually went online and researched, and it is true that the HCG can be used for different things. And it's women that like women that's not getting their cycle or something like that. Like, I read so much on it, so you may want to just go and do a little research on that part. As far as me, what I did the same thing that every other woman did as far as the trigger shot, and then, you know, went to go get the transfer. The only thing that I did differently, or that I was told to do differently, was, I guess, two different things. The first thing would be the HCG, in which a couple of the ladies in your comments had referred for you to speak to me about. I took my first mini dosage 2 days after my transfer, I believe. Let's see. one day. Yeah, I believe it was one day. Yeah, so it was like one day after my transfer, I did the mini dosage of HCG. And the thing about it is that I remember whenever I had my transfer, I was told do not take the possible mini dose until I talk to the nurse with my progesterone level. And from what I understand, depending on the progesterone level, that's what makes them say go ahead and give, you know, or go ahead and take the HCG mini dose. Now, I also read on here, ooh, I just got the shower and I think my skin is just dry. Just lotioned myself. Okay, so on here it's saying mini, the purpose, I'm sorry, I'm all over the place. I'm trying to hurry up. I have to go run some errands. This paper here is called Mini Dose Mixing Instructions. The purpose of the mini dose injections is to promote implantation, okay? The medication stimulates the ovary to maintain the hormonal balance necessary to support a potential pregnancy. That's the information that they gave me on my paper that they print out. And I'm gonna hide my social and date of birth information. But basically, as you can see on here, they basically gave me the instructions that I needed and the reason for taking it. So basically, I did Novaril. I never could say that word, huh? Novaril. So I had 10,000 units of Novaril. I injected 4 cc's of liquid into the Novaril powder. So basically it's 10,000 units with 4 cc liquid equals 25 units in each of 1 cc of liquid. So basically I filled all the way to 1 cc to administer. Each time your calendar says mini dose, you will withdraw 1 cc of the mixture and inject intramuscularly. I had to do it in my behind, y'all, and I had to do my trigger shot in my bun as well. And I was so scared, but I was like, you know what, I have to do this. This is for the babies. You know, I kept thinking in my mind, I have to do this for the babies. At the bottom it says you are prescribed to inject the mini dose up to 2 times during the luteal phase. So I'm assuming the luteal phase is basically the attachment phase, you know, and so forth. Also call if you are having any pain before giving the mini dose. If your ovaries are hyperstimulated, we may not want you to take the shot because it may make them hyperstimulation worse. And I did, I want to say that when I was doing my retrieval, I was hyperstimulating. My numbers were going up. So this right here, at this point, I was good. So they told me to go ahead and take it. Keep the mixture in the refrigerator between doses. Draw the 1 cc dose into the syringe and warm to room temperature before giving. You can warm it. You can warm it by holding it in your hand or leave it on the counter for 5 minutes. So I took it the day after. Yeah, I took it because I had it, I think it was that Monday. And then that Tuesday, yeah, I had to actually, or Tuesday, whenever I had it. But basically, the day after my transfer, I had to do the mini shot. And then it was 1, 2, 3, 4. About 4 or 5 days later, excuse me, I had to do it again. So basically, I had to do it on my one day past 5-day transfer, and then I had to do it 2, 3, 4, 5. I had to do it 5 days past 5-day transfer. That's the reason why I know a lot of people was wondering why I didn't test early, like some people do at 5 days past 5-day transfer. I could have gotten a false positive because this HCG can give a false positive. That's why when I went to do my beta, I actually did my beta exact 2 weeks. So I was exactly like 14 days until I did my first beta. And that's probably why it was like extremely, extremely high. Some people go in at like 9 or 10 days to do their beta. And unfortunately, with mine, that's just the way, you know, my doctor wanted it. And praise God, it was successful. Now, the other things that I did take along with this that maybe you didn't take before that you can mention to your doctor, I did, let me see, the week before my transfer, which I've been taking a prenatal vitamin since the beginning of, before I even did birth control. So prenatal vitamin, calcium, 1,000 milligrams, baby aspirin. I started doing estrus, which is estradiol. Let me see. 2 milligrams 3 times a day. So basically I took it 3 times a day. My prenatal vitamin, my calcium, my aspirin, doxycycline as well, and prednisone. I did that for 1, 2, 3, 4, 5, 6, because I did it on the same day as my transfer. And then on the day after, I still did the same medicines. I started the Cronone. The Cronone, the Cronone I've been started. Yeah, so I've been on the Cronone. So I did everything the same, and I don't think nothing changed. No, nothing changed until my first ultrasound, and he started me on folic acid. But like I said, our conversation is basically let's get you pregnant, and that we will do, girl. Other than that, that's all that I can say was different. Oh no, it was something else I told you I was gonna tell you. The Lovenox, okay. When did I start that? I got papers everywhere, and I probably don't even have the right paper here for that one. I thought I read Lovenox somewhere. Okay, so maybe I don't have it written in one of the papers right here. I have a stack of papers that I kind of pushed away because I'm in a new phase now, and I'm just like, I don't want to look at those anymore. But I did Lovenox, and I remember at my 9-week appointment, the doctor that actually did my ultrasound, I told her, I said, well, my regular doctor said that I could possibly stop the Lovenox on today when I went to my appointment. And so she goes, you're on Lovenox? And I said, yeah. She goes, She said, okay, well, I'm gonna check with the doctor. She's a new doctor as well. She's very, very new. And she goes, well, the patients that I have, the only reason I would put them on there is that they had multiple miscarriages. And in my mind, I was like, oh my gosh, my doctor is so smart. No, I have not had multiple miscarriages, but I feel like he was doing everything in his power to prevent a miscarriage and to prevent it not working. So I took, oh my gosh, those things are painful, and I hate injections as it is, but anything to keep my babies, okay? So I took the injections for about maybe a month or so. But once, you know, he gave me the okay to stop, then I stopped. But I'm not sure if you did do Lovenox or not, but I did that. And every medicine that I was told to take, I'm gonna be honest with you, I took the exact same time every day. So I would always do everything mostly in the evening, because when I worked, I didn't know my schedule, you know, in advance. So a lot of times I was working until, let's say the latest would maybe be 6:15 or 6:30. So I would always have my injections or medicine or whatever I had to do or take, unless I had to take something like 3 times a day. But if it was like injection or something I had to do every day, I would always do it the same time in the evening, and pretty much right before bed almost. But in the evening, that's when I would do my injections. So I would, like I said, when they say, you know, try and keep it, you know, the same, I did it the same. I can't say that that's what made it work or that's what did, you know, but I can honestly say that I made sure I followed everything by the book, you know, to the dot, you know, so I hope that helps. Oh, I know you said that you wanted information about how to get in touch with my doctor, so maybe your doctor can call my doctor. You did say that you're in Louisiana. I'm not sure how far you are. I know close. Like I said, I'm from Beaumont, Texas, and I know that they have a clinic in Beaumont. And I know if you're like Lake Charles area, Lake Charles is like right there by Texas. And it'll probably take you, if you stay in Lake Charles, it'll probably take you roughly about maybe 40 minutes to an hour to get there. And that's only because I know you have to pass through Orange, Texas, and pass through Biter and get to Beaumont and get through the traffic and get, you know, to the location. But it's a really, you know, straight drive, really. But anyway, the name of the actual facility is Corm. It's Center of Reproductive Medicine. The one that's in Beaumont is 3350 Dowlen Rd Suite E, Beaumont, Texas 77706. And I'll make sure I put the address in the inbox. I'm just not thinking like I could have just wrote it. And then the phone number to that actual facility, 409-898-1603. And the main line to get, like their very main line that they get all the calls, that's the only number I pretty much call, is 281-332-0073. And like I said, I'll include that information at the bottom. What else? Oh, and they have a website as well. And it's www.infertilitytexas, and that's together.com. So www.infertilitytexas.com. When you call, let them know that I did refer you there. They all know me. You know, just say LaQuisha. I'm pretty sure I'm the only LaQuisha. If there's another LaQuisha that's at that facility, then tell them that's the one that just got pregnant with twins. They pretty much all of them know me. I went to every location. I went to Beaumont. I went to Houston. I went to the Webster, and I think there's a new location that they have in Pearland, Texas, but I don't drive. I mean, Pearland is pretty much right there by Webster, so I don't, but I think that's the hospital. Yeah, that may be the hospital. But I think that's about it. And like I said, I'll include my doctor's name. I'll include the address information, the name, the phone number. And like I said, I would definitely give them, you know, a call and just see what they recommend, get some advice, get a consultation. Like I said, I'm not sure how far you are from Beaumont, but I'm gonna go ahead and go. This video could be extra long because I like to talk, so I'm gonna go ahead and go. Good luck, girl.